Information. Login. Incorrect username or password. Perhaps the account does not exist. Forgot password ? Keep me logged in. Cancel. Log in. Register. If you are a new user, please register with us first. It's free to sign up. Register. Your profile is out of date. Please take the time to update your profile. Update profile. Toggle navigation. Sections. Clinical. Industry news. New drug approvals. Operations and management. Opinion. People in pharmacy. Policy. Review articles. Technology. Web-only columnists. Leadership in action. Reimbursement matters education. CME. Monographs and white papers multimedia supplements. Corporate profiles. Pharmacy technology report classified subscribe. A newsletter. New print subscription. Renew print subscription contact. About us. Advertise. Contact info. Search. Go. Email this article. Posted December 28, 2016. Diabetes most expensive U.S. condition to treat. The most expensive condition, diabetes, totaled $101 billion in diagnoses and treatments, growing 36 times faster than the cost of ischemic heart disease. The number one. A link to this article will be included in this email. Recipient's email address. Enter email addresses separated by commas if sending to more than one person. 200 characters max. Your name. Your email address. Send me a copy. Personal message. Optional. These email addresses will only be used to send out this message. Send. Close. Share. Print. Email. Comments. FACEBO. Twitter. LINKEDIN. GOOGLE+. December 28, 2016. Diabetes most expensive U.S. condition to treat. By PPN News staff. Just 20 conditions make up more than half of all spending on healthcare in the United States, according to a new comprehensive financial analysis that examines spending by diseases and injuries. JAMA 2016 December 27. EPUB ahead of print. The most expensive condition, diabetes, totaled $101 billion in diagnoses and treatments, growing 36 times faster than the cost of ischemic heart disease, the number one cause of death over the past 18 years. While these two conditions typically affect people 65 years of age and older, low back and neck pain, the third most expensive condition, primarily strikes adults of working age. These three top spending categories, along with hypertension and injuries from falls, comprise 18% of all personal health spending, and totaled $437 billion in 2013. The top 10 most costly health expenses in 2013 were 1. Diabetes, at $101.4 billion, 2. Ischemic heart disease, at $88.1 billion, 3. Low back and neck pain, at $87.6 billion, 4. Hypertension, at $83.9 billion, 5. Injuries from falls, at $76.3 billion, 6. Depressive disorders, at $71.1 billion, 7. Oral-related problems, at $66.4 billion, 8. Vision and hearing problems, at $59 billion, 9. Skin-related problems, such as cellulitis and acne, at $55.7 billion, and 10. Pregnancy and postpartum care, at $55.6 billion. This study distinguished spending on public health programs from personal health spending, including both individual out-of-pocket costs and spending by private and government insurance programs. It covers 155 conditions. While it is well known that the U.S. spends more than any other nation on healthcare, very little is known about what diseases drive that spending, said Joseph Dieleman, Ph.D., an assistant professor at the Institute for Health Metrics and Evaluation (IHME) at the University of Washington, in Seattle. IHME is trying to fill the information gap so that decision-makers in the public and private sectors can understand the spending landscape, and plan and allocate health resources more effectively. In addition to the $2.1 trillion spent on the 155 conditions examined in the study, Dr. Dieleman estimated that approximately $300 billion in costs, such as those of over-the-counter medications and privately funded home health care, remain unaccounted for, indicating total personal healthcare costs in the United States reached $2.4 trillion in 2013. Other expensive conditions among the top 20 include musculoskeletal disorders, such as tendinitis, carpal tunnel syndrome and rheumatoid arthritis, well care associated with dental visits, and pregnancy and postpartum care. Advertisement. The researchers tracked a total of $30.1 trillion in personal healthcare spending over 18 years. While most of those costs were associated with non-communicable diseases, the top infectious disease category was respiratory infections, such as bronchitis and pneumonia. Other key findings from the paper include the following. Women ages 85 and older spent the most per person in 2013, at more than $31,000 per person. More than half of this spending, 58%, occurred in nursing care facilities, while 40% was expended on cardiovascular diseases, Alzheimer's disease and falls. Men ages 85 and older spent $24,000 per person in 2013, with only 37% on nursing facilities, largely because women live longer and men more often have a spouse at home to provide care. Less than 10% of personal healthcare spending is on nursing care facilities, and less than 5% of spending is on emergency department care. The conditions leading to the most spending in nursing care facilities are Alzheimer's disease and stroke, whereas the condition leading to the most spending in emergency departments is falls. Public health education and advocacy initiatives, such as anti-tobacco and cancer awareness campaigns, totaled an estimated $77.9 billion in 2013, less than 3% of total healthcare spending. Advertisement. Only 6% of personal healthcare spending was on well care, which is all care unrelated to the diagnosis and treatment of illnesses or injuries. Of this, nearly one-third of the spending was on pregnancy and postpartum care, which was the 10th largest category of spending. This paper offers private insurers, physicians, health policy experts and government leaders a comprehensive review, said IHME's director, Christopher Murray, MD, D-File. As the United States explores ways to deliver services more effectively and efficiently, our findings provide important metrics to influence the future, both in short and long-term. Related keywords. Healthcare spending. Plus show comments 0. Comment on this article. Post your comment here. You must be logged in to reply. Disclaimer. This board is intended for non-commercial reader comments. The posting of advertisements or solicitation of any kind is prohibited. Contributors are expected to conduct themselves in an appropriate manner, refraining from personal attacks and profane, coarse or abusive language. Hit the Report Abuse button to report comments that violate the rules and spirit of this board. www.anesthesiologynews.com reserves the right to remove without any notice comments that violate the intentions of this board. It is not intended to provide specific medical advice or to take the place of written law or regulations. The owners of www.anesthesiologynews.com assume no liability for the comments made on this board. Submit. More in policy. Gallup. Americans trust their pharmacists. According to a recent Gallup poll, Americans trust their pharmacists more. December 22, 2016. National patient safety efforts saved 125,000 lives and nearly $28 billion thanks, in part, to provisions of Obamacare. About 125,000 fewer patients. December 28, 2016. FDA removes boxed warning for Chantix and Zyban. The results of the trial confirmed that the benefits of smoking. December 19, 2016. More. Most read. CMS reports readmissions drop in 49 states. November 15, 2016. Policy. Probiotics improve cognition and Alzheimer's disease. November 29, 2016. Clinical. CS Steerly leak test takes a few steps back. November 7, 2016. Policy. Adventist Health saves $2.6 million via Central Film. November 15, 2016. Technology. Review articles. Angiotensin axis blocking drugs in the perioperative period. Drugs causing angiotensin axis blockade AAB include angiotensin converting enzyme inhibitor ACVR and angiotensin receptor blocker ARB agents. Compatibility of commonly used IV drugs. The number of available IV medications continues to expand. Many institutions have observed an increase in patient monographs and white papers. Hospital use of FLEXBUMI and albumin human and the benefits of flexible exogenous albumin is used for a broad range of clinical conditions. Historically, albumin has been packaged only. A role of ivabradine in reducing the risk of hospitalization for. This report introduces ivabradine, a novel treatment that reduces heart rate, as a potential option to B. Operations and management. Medsbeds yields $2.5M profit, boosts platinum satisfaction. In the 3.5 years since the University of Kentucky Albert B. Chandler Hospital opened a retail pharmacy, SNFs smell sweeter after robust medication reconciliation rollout. Dallas in 2015, leaders at TIR Memorial Derman, the 134-bed rehabilitation hospital for the Houston-based system, wanted to. Archives. November 2016, October 2016, September 2016, August 2016. More. To subscribe for a new print subscription, click here, New Subscription. To renew your print subscription, click here, Renew Subscription. Pharmacy Practice News. PPN strives to provide health system pharmacists with accurate, relevant and up-to-date information that improves their clinical practice. Home. About subscription advertise. Contact. iPad app. RSS feed. A newsletter. Click here to sign up to receive our newsletter. Social media. FarmPrac News. At FarmPrac News. Plus FarmPrac News. My account. Login. Register. Manage my account. McMahon Websites. Anesthesiology News. Clinical Oncology News. Gastroenterology and Endoscopy News. General Surgery News. Infectious Disease Special Edition. Pain Medicine News. Pharmacy Practice News. Specialty Pharmacy Continuing. CMedZone.com. McMahon Custom Media. McMahon Group. Copyright 2004 to 2016 McMahon Publishing unless otherwise noted. Pharmacy Practice News and PharmacyPracticeNews.com are part of McMahon Publishing. All rights reserved. Reproduction in whole or in part without permission is prohibited.